So yeah, welcome and thank you for joining us. So my name is Astor Castro, and I'm the Chief of Diversity here at Pre-Health Shadowing. Pre-Health Shadowing is a student-led, women-led, minority-led nonprofit organization that is dedicated to helping prospective healthcare professionals gain access to educational resources, no matter whether demographic status, their abilities, or location in the world. So just a little PSA, we do have closed captioning for all of our sessions to accommodate students with disabilities. If you need help enabling the live transcript, you can go ahead and direct message me or one of our team members, and we will make sure that that we help you out with that. Additionally, we are always looking for ways to improve and become more accessible. So if you have a suggestion on how we can do so, please email us at info@prehealthshadowing.com. So since this is an international program, we would love to know, where are you Zooming from today? Go ahead and drop it in the chat.
I have no idea.
That's awesome. We've got people from all over the world, all over the United States. We've got people from Puerto Rico. It's great to have you guys here today, and thank you for joining us despite how crazy some of these different time zones make our commitments. So just to keep you guys in the loop, we would love for you to follow us on social media or subscribe to our email list at Pre-Health, which you can sign up for at prehealthshadowing.com. And this is a great way to stay up to date with all the things that are happening with pre-health shadowing and the different events we are putting on. So I definitely encourage you to follow us or get on our email list. So we offer several different opportunities and our different partnerships as a pre-health program, and we want to make sure you guys have the best opportunity to use these resources and get connected. So first, we have partnered with Kaplan to get you guys a 10% discount code that can be used on all Kaplan products, and also gives you access to free resources. And this includes study guides for standardized tests like the NCLEX, the MCAT, the NCLEX, the PCAT, the MCAT, and the GRE. So if you guys want to get in on this, make sure to take our quick survey in the chat to give us your email so we can sign you up. We promise we will not be spamming you. This is just for Kaplan's use. And so yeah, it's a great resource, and it's helped me a lot in the different ways that I'm trying to study as a pre-med. So I highly recommend it. And so yeah. We would also like to draw your attention to another amazing program, which is Neolith. Neolith is an online mental health platform for students. We know college and young adulthood is stressful enough as it is in non-pandemic times, and especially add that onto the aspect of being a pre-health student, it can be a lot. So that's why we partnered with Neolith to give you guys free access to their services. If you use the link in the chat or enter the code pre-health when signing up, you can get this access today. So it's a really awesome tool as well. I do recommend it. It's helped me in some of my studying. So definitely something to check out. And we are looking at future collaborations with them too. So make sure to stay tuned on that. So Mask for Mask is another organization we would like to highlight today. Mask for Mask is an amazing woman-led organization that donates 4 masks for every 4 masks sold. And these go to people in need during the COVID-19 pandemic. And that includes people in the homeless community, healthcare workers without proper PPE, and others who are struggling to stay safe during this time. So if you use our discount code, which is PHS15, you can get 15% off your order, and 10% of the proceeds will go to PHS. And so that's kind of amazing because we are a student-led nonprofit, and we run solely off of the volunteering from our team members and the funding that we receive through kind donations. So if you guys want to help keep this program free, we would love for you to get some cool masks out of it as well. So definitely encourage you to use this discount code. If you are interested and want to play a bigger part in supporting pre-health shadowing, we would love for you to join our network of student volunteers and team members. You can apply to be a part of our administrative team and lead students in various projects and initiatives. such as grant writing, outreach, and other opportunities. But we do understand that as a pre-health student, you may not have that time. So we do offer volunteering hours that can be accredited asynchronously with tasks that can be done on your own time. And that may include like social media graphic design or writing for our organization. So we would love to have you be a part of our program and contribute your own unique perspective. So if you'd like to join us, make sure to follow the links in the chat. If you are a high school student, we would love for you to get involved as well. We have started a program which is called HTP, which is High School Training for Pre-Health Shadowing, and it allows you to connect with college pre-health programs and get more involved in pre-health shadowing and get organized resources with other high schoolers that might be interested in medicine. So this is, this will look great when you're applying to not only college, but med school in the future and really showing your dedication to getting into the field. So if you are interested and you are a high school student, make sure to also sign up as a volunteer utilizing the link in the chat and indicate on that application that you are interested in HTP. So we want to recognize all of the hard work of our students in the program. So if you are interested in getting published, you can submit essays, reflections, research papers, and reviews to our editor-in-chief through the links dropped in the chat and have your hard work recognized on our website. This will look good on CVs, applications, resumes, so take advantage of this. Part of our mission at Pre-Health Shadowing is to promote diversity, and in order to do this, we have launched an initiative to have monthly panels to celebrate different demographics in the field of medicine. And some of these upcoming events include an all-female panel for Women's History Month, the COVID Roundtable, and also an international student forum. So if you have a mentor, a professor, or a professional that has inspired you and you think they could contribute to these conversations, make sure to nominate them today by using the link in the chat. So if you can, we humbly ask that you donate to our program. As I've said, pre-health shadowing is completely student-run and we're working around the clock and around the world to keep this free and accessible to everybody. Unfortunately though, Zoom and our website are not free services. So if anyone can contribute, this would be greatly appreciated so we can keep our program up and running. If you are not financially able, we completely understand, and we just request that you send this link to someone you know who can contribute and help support those who can't afford similar opportunities. So throughout the session today, we encourage you to drop any questions that you have for the professional or about our program in the chat. In the second half of the session today, there will be a Q&A portion which our team members will be facilitating conversation with the professional and will ask your questions. So make sure as well to take good notes throughout the session because there will be an opportunity to take a post-shadowing assessment, which I will go into detail about at the end of the shadowing session today. And this will make sure you can get verified virtual shadowing hours for attending and get accredited through our website. So just one final request, if you can, please turn your cameras on. It's by no means an obligation, but it is to help us feel closer and a little more connected in a time when social distancing is mandatory, and this makes it feel more like a real shadowing session. So I appreciate everybody listening to my spiel today, and thank you so much again for joining us. Dr. Robinson, if you would like to go ahead and start sharing your slides, you may begin your presentation. Thank you. You can just go ahead and unmute to get started.
Here we are. So
Perfect.
Just a sound check. Is everybody hearing me all right?
Yes.
Yep.
Hi.
All right, excellent. Thanks so much. Well, I'm Dan Robinson. I'm Dean of the College of Pharmacy at Western University of Health Sciences. This looks like a promotional piece for Western University of Health Sciences, but really I'm here to talk to you about pharmacy, about the profession of pharmacy. So some of the slides that you'll see are sort of used for dual purpose because I also speak to students that come to campus and that are interested in learning about a career in pharmacy. So just understand let's make this as general as possible. And I'm more than happy to answer questions. Let me see if I can. So this first slide, those looks like pretty young kids in our laboratory there, and they actually are. Part of our outreach is to reach out into our high school community and even pre-high school students and bring them to campus and let them learn a little bit about what the world of pharmacy is. And these students in this laboratory are actually making toothpaste. So rolling up their sleeves and getting involved and actually making something in a compounding laboratory using the same equipment that we use when we do compounding. Let me just give you a little bit of background into my background. So I've been the dean here at Western U for the last 14, almost 15 years. Prior to that, I was dean at Northeastern University in Boston. And before that, I was at the University of Southern California as a department chair there for many years, total of 19 years there, previous history at University of Nebraska, and I'm a graduate of the University of California at San Francisco, and I also did complete a residency. But my background has, for many years, I've been involved in administrative pharmacy and pharmacy education. I'm actually a licensed pharmacist. I maintain my license. My specialty area of practice when I was doing teaching and patient care was actually in critical care and in cardiology. So one of the interesting things about pharmacy, while most of us know the world of pharmacy as it relates to community pharmacy, pharmacy exists any place where drugs are being utilized. So institutional settings, hospitals, clinics, all sorts of patient care settings. And essentially almost any specialty, any medical specialty you can think of, there's an equivalent in pharmacy. For example, my first job at the University of Nebraska after I finished my education, I worked on a surgical unit with surgeons, and I was managing drug therapy for patients while surgeons were very busy doing their surgery and other things that they needed to attend to. You can think of geriatrics, pediatrics, oncology, cardiology, critical care, emergency room. All of those areas have pharmacists working in them. So why pharmacy? Well, pharmacists are ranked among the highest for ethics and honesty. And for some reason, this is the first year that engineers have ever been on this list. So it was a little bit of a surprise to see that. But pharmacists have always been either ranked number 2 or number 3 of all the professions. So this is not just the health professions. So nurses rank very, very high with ethics and honesty. Medical doctors and pharmacists are always just pretty much equivalent. And then if you look at down toward the bottom, you see members of Congress don't do so well. And I think our recent political situation sort of highlights maybe why that is the case. In terms of pharmacy workforce, there's almost 400,000 pharmacists licensed in the United States. There are more women than men in pharmacy. There's tremendous opportunities. It's a profession that provides great flexibility for someone who's entering the professional workforce, because hours are quite negotiable. You can work, various shifts. You can work at night. You can work during the days. You can work part-time. If you decide you want to be a realtor and a pharmacist, you can do that. You can have multiple jobs and decide you only want to work in a pharmacy 20 hours a week. So there's quite a bit of flexibility. The women, the number of graduates, women graduates exceeded men graduates back in 1985, and that really hasn't changed. While it's a very attractive profession for women, it's equally attractive for men for all of the same reasons in terms of flexibility, income, stability, things of that sort. So where do pharmacists work? So this slide sort of focuses on places in the community where pharmacists might work. We're all familiar with independent pharmacies. Chain pharmacies are the most popular ones that you'll recognize: Walgreens, Rite Aid, CVS. Then grocery markets, grocery stores have pharmacies quite often. Albertsons has Save-On, Vons has pharmacies, Ralph's has pharmacies. A lot of your larger grocery retailers have pharmacies in their operations. Then we know of mass merchandisers such as Costco, Sam's Club, they have pharmacies as well. And then there's many other places as well, but that's just about 50% of all pharmacists work within a community setting. So where else do they work? About 43% work in some hospital or in some health system. So hospitals, ambulatory care facilities, that would be like clinics where you might go for your healthcare services. There might be a pharmacy located on the first floor of the clinic. In long-term care facilities, long-term nursing care facilities, managed care organizations such as pharmacy benefit management companies, specialty pharmacy. Specialty pharmacy is a very rapidly growing area, and that sort of focuses on fewer patients, but patients who require very special medications that are very expensive. So some of these medications cost $100,000 a year in order to maintain. And so management of those patients on those very expensive drugs is a real challenge. And it's very important that they take those medications, they understand how to use them, how to get the best outcome from using those medications. And then there are, the Food and Drug Administration, the Center for Disease Control, there's government agencies that hire pharmacists, and then academia, of course. And I'm an example of one of those academics who's a licensed pharmacist, but also very much involved in education. Pharmacy is a very good paying job. This is based on Glassdoor.com. And what they do is they do surveys of people in different professions, and any profession that reports 100, gives 100 or more reports, they report it in their online. And you can see that physicians are the highest paid, then pharmacy managers come in second, dentists at third, pharmacists who are not managers at fourth, And then enterprise architects are listed here as fifth. So it is a good paying job, and there is opportunity for growth. And there is essentially no difference between men and women in terms of salary and income and position within the profession. So directors of pharmacy, directors of health systems, presidents of organizations, you'll find that women have you know, the highest levels of responsibility in all of those types of jobs and positions. Over the years, pharmacy has really shifted in responsibility. We used to be very much a product-focused profession, and it's really amazing how things have changed. So pharmacy education parallels much more closely with medical education now, because a pharmacist's responsibility is to understand how drugs are used to treat disease, and pharmacists are very much involved in the management of disease. So if you're managing a chronic condition, if you're managing hypertension, you might work in a clinic environment, and the patients who have difficult drug therapy management issues, they're having a hard time controlling their blood pressure or controlling their diabetes, they'll be seen by a pharmacist who will manage that care. So work as part of a healthcare team providing very specific drug therapy management. But some of the other areas where pharmacists are involved is in the area of transitions of care. So as patients move from one healthcare setting to another, or one location within a healthcare setting to another, often there's confusion regarding what medications does the patient need to continue on, which ones should be stopped. When someone is discharged from a hospital or a medical center, they often write a whole series of prescriptions, and without much regard for what the patient is already on and what medications they have at home. And so this transitioning is very important, that pharmacists have taken a large responsibility for working with healthcare centers, physicians, and other health providers to make sure that patients fully understand what's expected of them in terms of drug therapy during these transitions of care. So patients might move from an emergency room to a critical care bed, to a step-down unit, to a standard unit within the hospital. And every time they move, often new orders are written, and you really need to make sure that there's no duplication of therapy or patients are not taking things that they no longer need based on their current condition. Another area is adherence, prediction, and optimization. So we know that when someone receives a prescription, excuse me, they might only, maybe 60 or 70% of those patients actually get that prescription filled. And when they do get it filled, often they don't take it, the medications as directed, and they don't get the refills as they're supposed to at appropriate time intervals. So pharmacists are very much involved in trying to predict how to make sure that patients understand the importance of taking their medications. If it's an antibiotic, make sure that you take all of it. Don't stop after you're feeling better, because you need that 7 to 10 days of therapy, regardless of how you feel, because having a few bacteria left in your system after 3 or 4 days is enough to allow colonization and regrowth of bacteria, and then you'll become reinfected if you don't take the medication properly. And then a lot of people don't achieve their therapeutic goals if they're not taking their medications properly. So there are some very serious conditions that require more than 90% adherence. If you're not taking 90% of the product that's being prescribed, you won't have a positive outcome from your treatment. Med synchronization is another area that pharmacists are involved with. Let's say you get a prescription filled during the first week of February, and then you have another prescription that starts in the third week of February, and both of those are for 30 days. Well, that means that every time you get that refilled, you have to go to the pharmacy twice a month in order to get that refilled or have it mailed to you. But what we're trying to do much more is synchronize and make sure that you're only visiting once, that all of your medications can be filled at the same time, to just make it more convenient. And convenience is also important to increase the amount of adherence. And then I'll talk a little bit more about chronic disease management and stabilization on the next slides. So just a very interesting fact for you is that 68% of Medicare enrollees have multiple chronic conditions, and that accounts for 93% of Medicare spending. Well, Medicare is the highest provider of healthcare services in the United States, and it's also more dollars are spent in caring for patients through Medicare than through any other type of health program. So it's it's really important to understand the role of chronic disease and how significant it is. We also know that chronic conditions account for 81% of all hospital admissions and 91% of all chronic of all prescriptions filled. So chronic disease is a real important area for us to think about. And for that reason, we know that since medication management is the primary form of chronic disease treatment, pharmacists' expertise and training in the post-diagnostic treatment of chronic disease is really very essential. So there's a huge role for pharmacists in drug therapy management for patients who are being treated for chronic disease. Once a diagnosis has been made, the pharmacist is in a good position to help in the management of that disease. Now you're probably thinking, well, how does a community pharmacist do that? And community pharmacists wouldn't usually do that. They might be involved in some aspect of it, but that's approximately 50% of pharmacists are actually practicing at some other place other than a community pharmacy, where they could very well be involved in disease state management. Now, another huge problem in the United States is medication errors. And we know that there are about 1.5 million preventable adverse drug events that occur every year. And 28% of hospital admissions in adults greater than 65 are due to some adverse drug consequence, adverse drug event. So there's a huge role pharmacists can play in trying to reduce adverse events from drug therapy. Approximately 34 Americans are killed in their home every day by a medication error. That's taking the medication incorrectly or taking multiple medications at the same time that should not be used together. And that's like the equivalent of a jumbo jet going down every week. And we haven't seen anything like that. And of course, during this pandemic, we've seen much higher rates of death due to the COVID. But medication errors continue to be a real source of morbidity and mortality in the United States. So, and we also know that problems related to medications are very expensive. So it costs about $290 billion a year in managing problems related to drug therapy. So pharmacists are part of healthcare teams. When pharmacists are part of patient care teams, patients have fewer adverse drug events, experience improved outcomes, and have lower healthcare costs. So we know that drugs can be very expensive. Pharmacists are in a unique position to know what drugs can be selected from a large number of medications that are available that will be able to be used optimally in a patient with single conditions or multiple diseases. And so they can improve outcomes and help control costs. When you think about medical education, most medical schools sort of focus on some 150 to 160 core drugs that they want medical students to know about. But there are actually over 10,000 prescription drugs that a licensed physician can prescribe. So much of the learning, the training that goes on in the health profession is really after a doctor graduates and starts practice. And then they start using medications and growing accustomed to using medications. But that really is the focus of pharmacy education, is focusing on the medications, focusing on the proper use and the avoidance of adverse reactions associated with drug therapy. In January of 2014, now I know we have an international audience here, so it's very interesting that pharmacists have been so associated with the drug product for so many years that they weren't actually added to the ranks of health providers way back when a lot of other people were identified as health providers when Medicare was established. And so it's been a battle. Most of the service that community pharmacists provide are sort of tied to the product. They're tied to, if you dispense a prescription, there's a dispensing fee. And with that dispensing fee, you're expected to counsel the patients and help them understand how to use it, train the patient on, whether if they're using diabetic, or syringes for insulin or diabetic monitoring equipment. And there really hasn't been a separate billing mechanism for pharmacists providing direct patient care. But right now, many pharmacists do not work in a setting where they're handling drugs. It's really what they're doing is they're working in teams helping to manage disease. And so there's been across the United States, there's been different levels of recognition as healthcare providers for pharmacists, and that is expanding and it's growing rapidly. And in California happens to be one of the most advanced in terms of provider status. So right now in the state of California, of course, throughout the United States, pharmacists are recognized as immunizers. The pharmacists have been very central to in the pandemic and the administration of vaccines. So that's in all 50 states. Pharmacists do provide vaccinations. In the state of California, pharmacists can initiate and furnish and provide any vaccine that's recognized by the, there's an advisory council on immunization practices that's part of the Center for Disease Control. And for anybody at age 3 or greater, pharmacists can provide whatever vaccine is necessary. So it's not just flu, it's not just pneumococcal vaccine, it's not just COVID, it's any vaccine that's required. And in some estimations, you know, as many as 40% of vaccines in the United States are now being provided by a pharmacist. Pharmacists can furnish self-administered hormonal contraceptives, so you no longer need a prescription in order to get hormonal contraception. You can go to a pharmacy, and that's different in different states, but that certainly is the case in California. Pharmacists can furnish smoking cessation products, which are prescription products that can be furnished by pharmacists. If you travel outside of the United States, a pharmacist can provide whatever travel medicines are necessary for that trip and that destination. For example, if you're traveling to a remote country and they have certain illnesses that are endemic to that country, it could be yellow fever, it could be in any number of malaria, for example. Pharmacists can provide all the, or make sure that you have the medicines that are necessary for that travel. And then there's also an advanced practice pharmacist status in the state of California. So sort of forget this why Western U. So please focus on the bottom, and I'm going to highlight some different issues that I want to bring up. In the US, there's a national licensing exam, which is the NAPLEX. Medicine has a national licensing exam, dentistry has a national licensing exam, all the health professions do. And there's also a California, so while there's national laws, there's also state laws that regulate the use of drugs and the practice of pharmacy or the practice of medicine. So just be aware that once a student graduates from pharmacy school, there are a couple of licensing exams that have to be passed. Interprofessional education is now a requirement of many health professions. So it's part of the accreditation standards for most health professions. And it's very exciting because it's what we're doing is we're developing the capacity for team-based healthcare. And it's been recognized for, you know, a couple of decades that team-based healthcare is a lot better and more effective than individual healthcare. So because people on teams bring different expertise and background, so patients really get better care if you have a different type of expertise participating. And this is a picture of, this actually happens to be in a pharmacy. The student here with his arm out is a veterinary student who actually works with large primates like gorillas, and he's getting a tuberculin skin test because primates can get tuberculosis from humans, and humans can get tuberculosis from animals. So there's a lot of zoonotic infections that can cross, that can be transferred from animals to humans. So this is a pharmacy student sitting over here who's actually doing the skin test. And then we have students from dentistry, nursing, physical therapy, who are part of this learning team. So we're learning about each other, from each other, with each other, to actually sort of improve everybody's understanding of how we're going to work together once we all get licensed and we get out there, and we need to rely on each other in order to provide a high level of care. So this is what interprofessional education is. And health programs, all the health professions really need to incorporate aspects of interprofessional education. The way curricula are designed, through much of your education, your calendar is sort of your guide to your life. That's how you study. It's your, you know, when you have projects due, you have quizzes, you have papers due, you have, you know, midterms, final exams, essays to write, and everything is driven by that calendar. What a number of schools have done, and we probably started that trend 25 years ago, is we developed a block curriculum which allows students to focus on one subject at a time. So all of the students are doing one thing. So it's not like on Monday, Wednesday, Friday, you're taking one class for 2 hours, and then there's something else on Tuesday and Thursday, and nobody's talking to each other, and you've got, you know, multiple exams due in the same week. We coordinate all of that to make your life a lot easier, so that everybody knows what you're doing at any time. So that's what the block curriculum allows, and it's worth looking for programs that offer something in terms of a block. Advanced practice experiences, all of the health professions have some sort of experiential education. So there's classroom didactic education, but a large part of your educational experience is going to be experiential, which is in the field, working in healthcare settings, working in hospitals, working in community pharmacies, working in clinics, working in long-term care facilities, VA settings. And so a year and a half of our 4-year curriculum is actually in the field with licensed pharmacists, with preceptors in interprofessional healthcare settings. And so it's really a big part of your education is the learning by doing, being where the action is. And honestly, learning about drug therapy, you cannot do it out of a book alone. Learning about so many drugs and so many diseases, you just can't read and memorize. You've got to get beyond memorization, and you really have to get out and see things happening and learn by doing, and you know, handling these drugs and understanding when you're dispensing a medication to a patient, what it's being used for, how to counsel that patient. You do counsel that patient then as a student. Pharmacy is kind of a unique health profession, or health educate, you know, for health education, because pharmacists are licensed interns. So as a first-year pharmacy student, you receive an intern license from the state of California that allows you to do anything that a pharmacist does under the direct supervision of a pharmacist. Unlike medicine, dentistry, or any other health profession, pharmacy students are all licensed. And it really opens doors for opportunities for them. And essentially, pretty much, you know, almost all of our students work at some time. They're working while they're going to school, because it's complementary. It reinforces what they're learning. What they learn in the classroom, they can go out and apply. They can get reinforcement in a practice setting. we use a lot of objective structured clinical exams. So our students are exposed to standardized patients. And it's sort of lucky that we're in Southern California because there's lots of out-of-work actors who we give them opportunities to act as patients. And so they get trained, they get to learn about how to present themselves as with bipolar disorder, with schizophrenia, with different diseases, and so our students are interacting with actors, and medical students do the same thing. They get exposed to standardized patients, and that's a big part of their training, so that when they get into the actual healthcare system, they're comfortable working with patients, asking the right questions, making sure that you're being culturally sensitive, that you understand where the patient's coming from, what the issues might be. So that's a big part of health professions education. One of the questions that I was sort of asked to address was, what are the opportunities for student organizations and leadership opportunities? We have many student organizations. There's the Health System Pharmacist organization, Managed Care. We have leadership organizations. The California Pharmacists Association has student chapters. We have honor societies within pharmacy. So all of these things are opportunities that allow for leadership growth and leadership development. Phi Lambda Sigma is a national leadership society that you can belong to within the health profession. And almost all health professions have a whole series of similar sorts of organizations that you might want to get involved with. And one of the quickest ways to propel yourself as a leader is to get involved in a regional professional association. So as a pharmacy student, if you start to work with the Los Angeles chapter of the California Pharmacists Association, or the Orange County chapter, the San Gabriel Valley chapter, San Fernando Valley chapter, there's all these chapters that have various organizations. So many of our students go on to become their presidents of these local associations because they were involved as students. They meet the people, there's networking, they build their leadership skills, and then 2 or 3 years out, they're already being elected as a president-elect of a regional professional association. So lots of opportunities for growth. If as students you're interested in research, most of the programs that you'd be thinking about have lots of research opportunities for you to get involved with. There's research in the clinical environment with our practice-based faculty. There's also research in laboratory environment with our pharmaceutical sciences faculty. Research in drug development. There's just many, many opportunities. In fact, every faculty member really, scholarship and research is part of their academic profile. And when a student comes up to them and says, what you were talking about in class and that research that you mentioned, that sounds very interesting. Are there opportunities for me to get involved? And you can be sure that faculty are very excited to have students that are interested in their research avenues. And then there's obviously opportunities for publications, national presentations as a result of the products of the research that you might be doing. Let me see if I've missed any big areas. So I just let you know, why did I go into pharmacy? I really wasn't interested in medicine. That that wasn't something I wanted to do. I thought, okay, well, pharmacy might be a little bit cleaner, not so hands-on, you know, touching a lot of people. But what I learned was you're doing a lot of touching in pharmacy. Pharmacists who are doing drug therapy management need to assess patients and see how they're doing. See if they're, you know, how their diabetes is being treated, need to, you know, check their blood pressures if they're monitoring hypertension. They'll be giving injections as part of immunizations, and there's other types of injections pharmacists might be giving as well. So, so that was sort of a mistaken notion for me. But I found pharmacy just to be very challenging and very rewarding. I did not like inorganic chemistry, but I did like organic chemistry. And so, but it turns out when you go to pharmacy school, you don't have to use that much chemistry. It's so much more important that you're able to do critical thinking and problem solving, and you know, learn about, you know, if you like detective work, you know, if you see an adverse reaction, or a patient's complaining about a rash, or they're having trouble with their eyes, or they're all of a sudden seeing double. The first thing a pharmacist thinks about is, could that be drug related? And then they start going through and thinking about, yes, there's these situations, and you know, which it could be related to that. So, you know, pharmacists are all the time discovering that, you know, patients have a new undiagnosed condition, and they refer them to their physician to, you know, have it checked out. So, so it's been very rewarding and a very exciting career and a great network. So I just have a tremendous national network of people that I work with. And in the state of California, I've been very lucky to, I'm currently the chair of the California Task Force for Advancing Pharmacy Practice. And I'm in the process of writing a Pharmacy Modernization Act for the state of California to recognize pharmacists as healthcare providers with all the rights and privileges that go along with that. And I have a great group of people up and down the state that I'm working with in order to achieve that. So there's a lot of rewards. Very, very, very satisfying. So with that, I would be happy to open it up for questions. Let me stop sharing my screen. And wow.
Yeah, I can go ahead and ask some of the questions that were put in the chat. Additionally, I'd like to invite anybody who's in this session today, if you would like to use the raise hand function, I can facilitate you guys asking your questions out loud to Dr. Robinson. So just to get started on some of the questions that were in the chat, one question was, how can you get exposed to the pharmacy profession besides working as a pharmacy technician?
Well, I mean, you can work, there's other positions within a pharmacy. I mean, you can be there are other staff positions within pharmacy. You can also, if you work just in a healthcare setting, any position within the healthcare setting would give you an opportunity to possibly be, you know, exposed to what it is that a pharmacist is doing. Being a pharmacy technician is a great way to learn about pharmacy, but it's really sort of also a deep dive. You've sort of made quite a bit of commitment if you become a pharmacy technician, but it really is a great stepping stone. Doing volunteer work, it is a little tough, and I'll admit it, because there are very strict rules and regulations for who can be in the pharmacy proper. So they're just really not allowed to have visitors in the pharmacy. So there's laws that prevent, because there's dangerous drugs and chemicals and things like that, and it's just for everybody's safety. But certainly pharmacists are very accessible. If you think back to the pandemic, and of all the health professions, pharmacy is the only one that never closed, never stopped providing their services to the public. Dentists stopped, medical visits went virtual. You couldn't get appointments for physical, you couldn't get routine care anymore from your health providers, but pharmacists were always there. The pharmacies were always accessible. So pharmacists, as the most accessible health profession, you can walk into a pharmacy anytime, introduce yourself to a pharmacist and say, I'm really interested in learning more about the profession of pharmacy. And there will be a pharmacist there who will stop what they're doing and will talk to you about that. They really are accessible, and they're there to talk to you about, about the profession of pharmacy.
Thank you for sharing some of that. And it's absolutely true that I think pharmacists have been some of the healthcare workers that have been not necessarily brought up, but like more recognized in light of the pandemic. So I was wondering if maybe you could give a little more insight onto that and about how you think maybe that's going to change the kind of dynamic of pharmacy and medical education moving forward.
Well, it's a great question, and thank you for asking it, Esther. The pandemic has really brought to light the importance of pharmacists and the role of pharmacists. So pharmacists are distributed throughout the United States, and it's estimated that 90+% of the US population is within 5 miles of a pharmacy. So even in the most rural parts of the US, people have access to pharmacy. So they're always there and always available. And all of a sudden, pharmacy is everybody's best friend right now. The Congress loves pharmacy, the CDC loves pharmacy, public health loves pharmacy, the state of California loves pharmacy. So it's a great time to be a pharmacist because pharmacists have demonstrated time and time again that they're willing to step up and provide necessary services when asked. We have students that are involved in the mass vaccination campaigns at the Pomona Fairplex, at Disneyland, at various large distribution facilities throughout Southern California, throughout the United States, in fact. So because students are licensed interns and they're trained to vaccinate within the first year of their pharmacy program, student vaccinators are a huge benefit to society right now. So I think this is a golden opportunity for pharmacy, really. While it's a national tragedy, what you learn through tragedies is that it makes us rethink the way we do things. Could we do them better? Are we utilizing healthcare professionals in appropriate ways? And quite often, professions expand their scope during time of crisis because they're needed so desperately. So it's an opportunity, and it's one that I think we've stepped up and really done a good job. And the job market is very hot right now. Places are hiring thousands of pharmacists. They can't get enough of them right now.
Absolutely. And going off of that a little more, I know that something you did talk about a little bit was, following up with patients, making sure that they're taking their medications, and a lot of that does come from the pharmacist as the people who are, distributing the medications, and that's where a lot of people get their education on what drugs they're taking and how they should be taking them, and are kind of followed in a way to make sure that they're getting refills at the proper times and all of that stuff. But I guess something that also has come about with COVID is a little bit, for example, with vaccine hesitancy and people not necessarily having that trust of healthcare providers. So how do you think that, or how might you suggest that moving forward, pharmacists and other healthcare providers work to build that trust between the communities they serve, and also to make sure that they're helping the best way they can, and that everybody is, in this trusting relationship that can, facilitate the best health for everybody involved?
There was actually just this week a publication that talked about the West Virginia experience. And West Virginia is a very rural state, and people are distributed in a lot of rural communities. And there was a lot of vaccine hesitancy. And it was because of the relationship that pharmacists have in their communities that people, they just had a huge uptake in people getting vaccinated that really needed those vaccines, because they trusted their pharmacists, because they had a relationship with their community pharmacists. And they said, this is a person I can trust. This is a person that is interested in my health and my well-being. And so I think we need to depend more and more on personal relationships and building those networks and building confidence in the community. And I think regardless of what health profession you go into, get involved in your community organizations. People will look up to you as a health provider and look to you for guidance, and look for you if, I get asked all the time, should I take the Johnson & Johnson vaccine, or should I wait, for the Moderna vaccine? And so they ask health professionals, and they really trust the answers that you give. So get involved in your community and help educate your community.
Thank you. I think that is something that's very important to keep in mind as we move forward, wanting to be providers, that it is very much not just about being able to communicate with other providers, but also being able to communicate with the population you're serving, and make sure that everybody has that kind of that relationship and that bond that can facilitate health and the feeling of security with people who are taking care of you. So sort of related to that as well, how has the opioid epidemic caused pharmacists to change what prescriptions they recommend to patients, and how has that maybe impacted the relationship people have with their community providers?
The opioid epidemic?
Yes.
Well, pharmacists actually have what's called a corresponding responsibility. So the pharmacist is really responsible when they're presented with a prescription. They need to know that it's a valid prescription and it's for a valid purpose. And if it's not, then a pharmacist can be liable for something that might happen to the patient, even though they've received a prescription and they filled the prescription. If the pharmacist hasn't verified that, okay, this is for a valid condition, I know this patient and I know this prescriber, you really have to be very careful. So pharmacists have really been had a central role in to try to work to control and make sure that opioid use is appropriate. There's been a large campaign across the health professions. Anybody who prescribes is much better aware that you don't give 30 OxyContin if you can get away with giving a prescription for 7 of them. You do not want extra supply out there for youngsters or people who don't have good intentions that might be using those and using them in a harmful way. The other thing that pharmacists can provide is Naloxone. So when dispensing a narcotic, an opioid, pharmacists are also authorized to prescribe Naloxone to to either a friend or a family member, so that if someone is found unconscious, and it could be related to an opioid overdose, and then a naloxone injection or inhalation, or nasal delivery, can reverse that immediately. So pharmacists are doing that as well, and educating patients on how to use that and how to use it appropriately.
Thank you. I didn't know that, so that's actually very interesting. I see that somebody has their hand raised. If you would like to go ahead and ask your question.
Hi, it's
Yes,
me.
go ahead.
Hi, I'm a med resident. So, in the hospital setting, I see a lot of times at the hospital that I work at that people cannot pay for their prescriptions. How can you guys as pharmacists try to help in that matter for somebody who really needs their heart medicine or really needs a certain type of medicine for a condition that's as a severe patient need?
Right. Well, that's one of the reasons why we really need to be working as a team. There might be options. For example, the medication that's being prescribed, maybe there's a generic alternative that would be affordable, or would be available for almost nothing. You also find that there's a lot of medication assistance programs for patients. Pharmaceutical companies that have very expensive products often have medication assistance programs available to people who are unable to pay for those medications. They want their medications to be used, and they realize that not everybody's going to be able to pay for it. So unfortunately, that's in part why it's so expensive for those who can pay for it, because they have these assistance programs that can provide very low cost or almost free medications. And there's also FQHCs, there's federally qualified healthcare systems that can provide.
I do understand that, but there's people who have went through their government assisted programs and they still can't get the proper medicine for their healthcare need. And I feel as a resident that I see that so much during the hospital setting with, very indigent type of people that need their medicine and they have no more resources. So I don't know what to recommend, and that's why I'm kind of upset with the pharmaceutical system here, is because we have people out there who are dealing with chronic illnesses and people who are, dealing with issues that can't be resolved with just therapy in itself. We need, like you said, to work as a team, but we also need to find a way to help those people with the major chronic illnesses that need medicine. And that's why I'm so upset with the system. But my question is, I'm sorry, but my question is, how can pharmacists educate the patient in the hospital setting? Sorry.
Well, I mean, that's actually a responsibility. In a lot of hospital settings, there are pharmacists who will gladly go to the patient's bedside prior to discharge and educate them. They have, even during the pandemic, there's virtual ways of doing that. Having a pharmacist educate them about their medicines. Developing a relationship with that patient. You want when a patient's being discharged, it is a very, very confusing and complicated time for a patient and a family, because the nurses are giving them instructions, the physicians are giving them instructions, respiratory therapy is giving them instructions, pharmacy is giving them instructions. So you can figure that probably they're only going to retain like 20% of what they're being told within the, the 6 hours leading up to discharge. So it's very important that you follow up almost immediately, within 24 hours or 48 hours at the latest, and make sure the patient understands what they need to do and continue to do for the next week and the next 2 weeks and beyond. So it's just not a one-time, you're out of here, goodbye. We have to continue to, have that handshake with the patient and maintain the relationship. So the patient, otherwise they're back in the emergency room. They didn't get, what was all that stuff you told me to do? I didn't do it, and now I can't breathe. So, or, my heart failure is out of control. But also just, I wanted one thing. The pharmacy profession is not related to big pharma.
Okay.
We do not control the price of drugs. They're controlled by pharmacy benefit management companies and pharmaceutical manufacturers. And we do everything we can to help patients understand. For example, sometimes a patient's copay is higher than the price that they would have to pay if they paid out of pocket. So if they have a $20 copay, but this drug would only cost you $6 if you wanted to pay for it. Pharmacists can help people find the path to, this stuff is expensive, and we would love to see the prices come down as much as possible.
Yeah, and my last question is for you, Dr. Robinson, is can you compare what pharmaceutical medicine was when you first started in the pharmaceutical industry and when you are now in the pharmaceutical industry? How is it how does it differentiate?
Well, there was a time years ago when there were laws that actually prevented pharmacists from discussing what the prescription was for. So you'd get a prescription, you'd fill it, and you give it to the patient, and really almost without directions. And the pharmacist was not allowed to even tell the patient what it was for. In fact, we still have a problem. We receive prescriptions and we don't know what the indication was. And so we would love to see the indication on a prescription so we can better counsel the patient about how to properly take the medication. But pharmacy has evolved tremendously. I mean, the educational system has gone completely from product focus to patient focus. So it really is about patients. It's about patient outcomes. It's about healthcare. It's about understanding disease. It's understanding optimization of drug therapy. We spend 80+% of our time in that area. Nobody actually teaches us how to count by fives. That's something we do not do in pharmacy school. So it's very health profession related and interprofessional at this point. So it's a big transition.
Thank you.
Yeah, of course.
Thank you
it's always great to have that interpersonal team. So as a future, when I specialize in hospital medicine, we can have the hospitalist, the intensivist, the respiratory, the nursing therapies in there. So like you're saying, a smooth discharge can happen so we don't have a reoccurrence back in the ED again, is because that's exactly what we have, because we have so little explanation on, okay, Mr. Jones, you take this medicine for this amount of days. How do I use an inhaler? How do you know if it's going into my lungs? Because we don't have that explanation, and I wish that explanation was more clearer, and the pharmacist or the nursing staff could actually take classes in pharmacy. That'd be great to explain to what we as doctors are trying to say to the patients, because patients have no idea. Patients never went to medical school, never went to pharmacy school. They're saying, okay, take your lisinopril every day. I take my what every day?
Yeah.
What is that for?
Too often, people assume that someone else is doing that. That someone else is educating the patient, or
Right.
But really, we need to take on that responsibility.
Yes, because we see a lot of reoccurrences in the emergency department because these patients don't understand what they're taking the medicine for. How does it work in my body? See, as a doctor, you get to study that for God knows how long. And, you can't be like when I'm a patient in the hospital, you don't like to see me in the hospital because I'll tell you what to do. But see, I have that education. Many people like Joe Smo on the street don't have that education. So I wish that would be a standard thing as well as looking for drug seekers.
Right.
That's all I have for today, but thank you.
Thank you.
Thank you so much. Okay, so we're going to get to the last couple of our questions here before we have to wrap up for the session. So we did have some questions from international students, and they were wondering about getting, for example, one of our students is Vietnamese, and they're thinking about getting a pharmacy degree, and they're wondering how that might translate in different countries. If you have any ideas about that or experiences with getting a pharmacy degree in the U.S. and how that might affect getting a job using that degree in a different country.
Well, actually, I'm going to do a plug. We at Western University of Health Sciences, the College of Pharmacy, we have an international post-BS PharmD program. So if you happen to be a pharmacist who's trained internationally, we have a track-in program so that you can get a U.S. degree and a U.S. license. And it's a 3-year program as opposed to a 4-year program. Some foreign pharmacy graduates are actually able to take a foreign pharmacy equivalency exam. The National Association of Boards of Pharmacy administers that. But there's only a handful of schools in the US that provide this post-BS PharmD training and experience so that you'll have a doctorate in pharmacy and be able to be licensed in the US. I'm not aware of any programs that are, if you don't already have a pharmacy degree, if you have a different type of degree, we might be opening up and expanding options for people with other types of degrees.
Thank you. So another question we had was, what was your experience like as a critical care and cardiology pharmacist specifically, and what drove you into that niche of medicine?
Yeah, that was a very exciting area. I always found that when you're in a critical care unit and you're with the sickest patients, everybody who's caring for that patient is practicing at the very highest level of their license. And everybody is interested in what everybody has to contribute. So team-based care is at its peak in the most critical environments. You'll find it in disasters. Everybody works very much better together in a disaster because there's a common focus, there's a common goal. Everybody knows what has to be achieved. You pull out the best ideas that you have in order to keep that patient alive or to take care of the situation. Well, that's the way critical care medicine is, and working in a critical care unit was very much that way. People are very much codependent on each other. They needed the drug knowledge that I had, in order to optimize the patient's outcomes. we needed the respiratory therapist, we needed the nurse, we needed the best of everything in order to maximize outcomes for our patients. And so it was just a tremendously collaborative environment that I found very stimulating and exciting. And I just absolutely loved it. The other thing is I came to work every day never knowing what I was going to have to encounter. And it really you had to be able to think on your feet. So you couldn't study the night before because I'm coming in and I'm, got to be prepared to be able to do this. You have to think on your feet when you're dealing in a critical care situation, and everybody does. So I just really enjoyed the thrill of working with people at the top of their profession.
Thank you, and thank you so much for coming in today. We are nearing the end of our session, so if you would just like to give like any last minute advice, or if there's anything specific you want to share with us before we do end our session today.
Well, I would just thank you for the opportunity. I'm always happy to share. I'm passionate about what I do. I live and breathe it. In fact, I've just taken a 3-month I put myself on a 3-month administrative reassignment so I could focus on advocacy and the legal issues regarding the pharmacy profession and write actually this Pharmacy Modernization Act. So I've really completely thrown myself into it, and I've given someone else an acting dean position while I'm doing that. So at the end of March, I go back to being dean again. So, but I've enjoyed this time where I can really focus. And I just think there's so much room for great talent and people who get passionate about things, because there's a lot to be passionate about these days. And providing healthcare, making sure that healthcare is equitably distributed, that everybody has access, that we're taking care of every citizen. Those are the things we need to focus on. And I think, getting great minds together and trying to solve some of these just basic delivery issues is something that we just need the best and the brightest to make that happen in every profession. We need to work together closely.
Absolutely. Thank you so much for sharing that. And that is inspiring to hear that there is so much still to learn, and you don't ever have to stop in your profession. You don't put yourself on a reassignment for 3 months and say, no, this is what I'm going to do to better myself, no matter where you are in your journey as a professional, as a student, as a provider, just to make yourself the best kind of person to serve your community that you can. So thank you so much again for joining us today. I definitely learned a lot about pharmacy from this session, and something I hadn't necessarily considered in the different aspects as a medical student, but I really enjoyed your presentation today, and I think a lot of other people, just by looking at the chat, got a lot out of it. So thank you once again.
Thank you, my pleasure. Bye-bye.
Bye. Okay, everybody. For all my students, I'm going to go over a short wrap-up presentation to let you know how you can take your post-shadowing assessment. Okay, so as well as the presentation, and considering that, we'd like you to kind of reflect on the session today, if you'd like. So what brought you to the session? What are 3 major takeaways that you got, and what do you want to learn more about? We encourage you to take some notes. Take this from your notes that you wrote down, or just quickly write it on a piece of paper, because it is important to be able to look back on these things when we are applying to our professional schools in the future and know what got us to the point that we are at. So I would encourage you to do that. And if you would like to share your writing and your reflection on the session, you can definitely submit your thoughts today at treehouseshadowing.com/blog submissions. And our editor-in-chief will go over that and get you published on our website. It's a great opportunity for, CVs, applications, and resumes. So I encourage you to take advantage of that. if you are interested in learning more about pre-health shadowing and want to get involved in our program, we encourage you to visit our website at prehealthshadowing.com, and you can become either an asynchronous volunteer to get certified hours through our program and helping, nominate professionals and network with different people. Or you can also become a team member and be up here with us and take on a more active role in pre-health shadowing. So if you are interested in that, make sure to sign up, and hopefully we'll meet you soon. So once again, remember, if you're financially able to, that you donate. We are a student-led nonprofit organization, and we run solely off of the commitment of our volunteer team members and the kind donations that we receive from our community. So if you can, please donate. It can be $1, $2, $3 maybe if you're really feeling crazy today. And we would love to have your support. Of course, we understand if you're not able to, and so you can definitely just share and spread the news about our program to help as many students as we can. So now for the part that we've all been waiting for, earning our virtual shadowing certificates for attending the session today. So the first thing you're going to do is you're going to go onto our website and you're going to find the page for Dr. Robinson. It will likely be, it can be easily accessed from the homepage if you scroll down and just see previous sessions. His will be the one at the top. So once you go ahead and click on his profile, you can click take this course and it will be free. If you don't already have a profile on our website, you can just sign up real quick and easy. You can use your student email, you can use your personal email, it doesn't matter. It's not going to charge you anything. You're not subscribing or making a commitment. It's just so that you can keep track of all of the hours that you earn. So next thing you're going to do is click take the quiz, and you're going to take a 10-question multiple choice quiz, and you have 30 minutes per attempt. You have 2 attempts to get a 70% or higher and earn your virtual shadowing certificate. So we have experienced a lot of traffic on our website recently, which is why we make sure to give you guys at least 2 chances to take the assessment, because there has been issues with, the server crashing or just because of the high influx of students that we have. So if you have a little patience, we would like for you to wait a half an hour, maybe 45 minutes after the end of the session to go onto our website and try to take the quiz. Of course, this session has been recorded and it will be up on YouTube and our website probably by the end of today. So you can be able to go back and watch this if you do need a refresher before you take the quiz. But again, this is not meant to be a super tough quiz. There's no studying you have to do for it. As long as you're present today at the session and generally paying attention and, got the messages that our professional was communicating to us, you'll be fine, you'll pass. But once you do, just go ahead and click, you can make sure to click finish this course to download your certificate. If you want to see certificates from prior sessions that you have earned, you can go to your profile at the top of your page on the website, and you can go to the Earn Certificates tab. If you did miss part of the session today, as I mentioned, this recording will be up on YouTube and on our website. You can also go back and watch any of our previously recorded sessions that could date all the way back to September of 2020. So if you were really looking to, rack up those virtual shadowing hours, you can definitely do that. Go on a binge watching episode of all of our previous shadowing sessions and take our post-shadowing assessments, which are available indefinitely on the website. So go find, more pharmacists if that's what you're interested in, or maybe you want to learn more about oncology or PA professions. So there's a ton of different specialties and professionals that we've hosted, and I encourage you to check it out. So also be sure to stay up to date on pre-health shadowing and all of our sessions, which we are hosting every weekday through June. And it's really exciting, but we've got all these professionals that have hooked us up. So I hope to see you guys there. And again, make sure to subscribe to our email list or follow us on Instagram or TikTok, which we are both active on, and make sure that you are staying up to date with all the events going on with pre-health shadowing. So I want to thank you all again for joining us today. I know we did have that little bit of a time zone mix up earlier, so I appreciate everybody who did come to this session earlier and now to and made time to listen to our wonderful professional. If you have any questions, you can feel free to stick around, or you know, unmute yourself, drop them in the chat. I'll be here with a couple of my other team members. Otherwise, everybody else, our virtual shadowing session today is officially over, and I invite you to sign off.